it's a grant that really builds on a lot of what we have been doing for quite some time, over 10 years of implementing impactful lupus education and training interventions for healthcare providers while leveraging our robust network of subject matter experts and collaborators.
Hmm. So how will it be used? Mhm.
Well, there's a few primary areas that the grant outlines, and one is to increase the knowledge and skills of healthcare providers in accurately identifying signs, symptoms, and care management for lupus. The second would be to amplify the ability of providers to utilize electronic health records to track lupus symptoms and validate diagnosis. Third is strengthen the availability of culturally and linguistically appropriate materials and training for providers and lay people in high-risk communities. And then one of our other areas is expanding the training of school-based health practitioners to support the transition of pediatric to adult care for patients with lupus.
Which is a need, right? There previously was a gap between the pediatric and adult patients. Can you describe what that gap is and how this will help close the gap in care there?
Sure. The childhood onset lupus is such a vulnerable time. Lupus in general is, but imagine having it as a child and then transitioning with any level of care from pediatrics to adult care is difficult, but then to layer on the complexities of lupus and the different providers involved, there was really nothing um, in this space that was being expanded into healthcare providers and into the population of patients that it afflicts most, at least on a broad level. And so this is really going to pave the way towards that. Well, when you have providers, especially school nurses, who are in the environment who are skilled in interacting with the students, to get them these students with lupus in an environment where there's trust, there's interaction along the lines of healthcare, to train them to appreciate and understand the complexities of lupus and to facilitate the transfer of education and support to the students who need it the most is exactly what we're trying to target. That's right, primary care physicians, and that's our primary focus, but it also includes a variety of what we call frontline providers, physicians and healthcare providers who would tend to see people with the symptoms of lupus initially. So obviously that includes primary care providers, but also emergency room physicians, nurse practitioners, physician assistants, and so forth.
And I can imagine that that is needed because there is such a shortage of rheumatologists. I think there are maybe 3,000 rheumatologists in the country, 2,000 rheumatology nurse practitioners. Is that correct? And
That's right.
how many millions of people with rheumatic disease in the country?
Yes, quite a few. And what's a challenge about many of our conditions that we treat in rheumatology is that the symptoms can be nonspecific, meaning there is no one, two, or three things that you look for specifically in a lot of our conditions. So people tend to go to their primary care doctor, as they should, or other frontline providers to get these symptoms addressed. And so that's why we're targeting them to try to get the diagnosis and the appreciation much earlier, which obviously will improve outcomes. In terms of the types of programs that we plan to do with the support from the CDC, include using rheumatology fellows for lupus education. These are physicians who are in training to be rheumatologists, and they have the expertise at that level to teach frontline providers about lupus, and they have the enthusiasm and often the time to do so. So we have a program to roll that out across the country to different programs that train these physicians to then be able to go out into their communities and to teach others.
Mm-hmm.
We also have culturally competent cases that are embedded within a variety of CME programs that are mostly online that cover topics like diagnosis, testing, management, renal involvement, reproductive issues that are quite important in a condition like lupus that afflicts predominantly women of childbearing age and issues like disparities. So that's an exciting part of what we plan to do.
Mm-hmm.
And then there's a whole component of utilizing healthcare records to track lupus symptoms and validate diagnosis. There's a what we call the RISE registry at the American College of Rheumatology that connects to a variety of portals and electronic healthcare records from throughout the country of practices and physicians who have gave permission to connect. And it brings in a variety of information. And on the front end, we'll be working with these providers to implement the promotion of tracking of lupus symptoms and disease activities, utilizing their healthcare records and using that information to improve care and to learn more about the outcomes of people with lupus. Sure. One final thing about a program that I forgot to mention is this community healthcare workers program. It really goes into lay education, which is a bit different from what I've spoken about before. And this is a program where we teach these community health workers how to educate their own communities through organizations and churches and associations using culturally and linguistically appropriate resources. And so that really extends what we try to do as physicians one-on-one and in smaller numbers into the broader community using lay resources through these community workers that truly understand how best to interact with the community that we're trying to serve.
Mhm.
I
Well,
encourage them to visit the American College of Rheumatology website, rheumatology.org, and you can look up the grant, the collaborative initiatives um, committee, and you'll see links to the people involved in this program, and we'll be happy to connect you. We need lots of volunteers.